Hello and welcome to the Canada News with your host Gurdwara. Now let's have a look on the headlines. Canada's Procurement Minister Anita Anand reports that 31 million doses have been delivered to provinces and territories. Canada's Health Minister Patty Hajdu has thanked all Canadians for following public health guidelines for nearly a year and a half. Canada's Chief Medical Officer Dr. Theresa Tam said 1,800 cases were reported daily across the country in the past week. Now news in detail. Canada's Procurement Minister Anita Anand reports that 31 million doses have been delivered to provinces and territories. 27 million Canadians have received a dose, which constitutes 70%. According to Anita Anand, Pfizer is sending 2.4 million doses every week.
Hello everyone. As of today, we have delivered 31 million doses to the provinces and territories, and they in turn have administered 27 million doses of vaccine. 70% of eligible Canadians have had at least one dose of vaccine, and Canada is first in the G20 in terms of the share of population with one dose. In terms of Pfizer's vaccine deliveries, Pfizer continues to deliver 2.4 million doses of vaccine per week during the month of June. In terms of Moderna, I would like to share with you a further update on its June deliveries. As I have mentioned previously, we continue to work with the company to stabilize its deliveries to Canada, and that work is paying off. Today, I'm able to announce that Moderna will deliver 7 million doses in June, with shipments commencing next week. These deliveries will include, for the first time, doses from Moderna's U.S. supply chain. I would like to sincerely thank Ambassador Hillman and her team for their tireless efforts to help facilitate this. With the addition of the U.S. supply chain, there are certain regulatory and logistical considerations that are in the process of being addressed, and we will be in a position to provide more specifics concerning specific shipment dates and quantities in next week. With millions more doses arriving prior to the end of June and into the summer months, based on confirmed deliveries alone, Canada is set to receive at least 55 million doses by the end of July. To be clear, that is the minimum number of doses that we anticipate receiving in that time frame. Given my work every day with an incredible team at PSPC, we are continuing to press suppliers to accelerate doses as we have from day one. In fact, we have accelerated 28 million doses from later to earlier quarters in this year alone.
Canada's Health Minister Patty Hajdu has thanked all Canadians for following public health guidelines for nearly a year and a half and supported in the fight against COVID. Hajdu said 70% of Canadians had received the first dose. As a result, the government is making changes for people who have received both doses for border restrictions and for international travel.
Canadians have been doing astronomical work to protect each other over the last year and a half. They've followed public health advice. They've stayed home. They've made changes to the ways of their life to keep everyone safe. And we know that Canadians have sacrificed so much to protect each other. And the Government of Canada also has some of the strongest border measures in place to help protect Canadians. We've used data, we've used scientific evidence, and we've monitored the situation both in Canada and internationally to adjust our measures as the situation warranted. And we've been clear with Canadians that we would continue to adjust measures as appropriate as the situation evolved. And we're now seeing a ramp up of vaccination rollout across the country. Nearly 70% of Canadians have received their first vaccine dose to date, and second doses are rising rapidly. And we know that these vaccination rates matter. Vaccines are saving lives and stopping the spread. But we also know that the strong public health measures that are in place across the country are contributing to lower case counts and reduced hospitalization. And these metrics are the metrics that we'll continue to monitor as we and that will inform the changes to the measures in place. Now, with the situation improving in Canada, today I want to provide Canadians with more details on what they can expect in the coming weeks. As the Prime Minister has said, we'll take a phased approach towards adjusting current border measures, with the health and safety of Canadians being our first priority. What is currently being considered as the first step in this approach is to allow fully vaccinated individuals currently permitted to enter Canada to do so without the requirement to stay in government-authorized accommodations. Travelers would have to be fully vaccinated 14 days or more prior to their arrival. And they will still be required to have a negative pre-departure PCR test result and required to be tested upon arrival, with a suitable quarantine plan to wait for their day one test result. And we'll be watching carefully here in Canada and around the world as cases change and as vaccination rates rise. These metrics are very important factors as we move towards implementing the changes on the border that we hope to have in place in early July. Now, all of these changes are only possible if we continue to protect each other. And we know how to do that after a year and a half. Get vaccinated when it's your turn. Follow up for your second dose. Make sure we're following the public health measures that we've all learned over the last number of months to protect each other.
Canada's Chief Medical Officer Dr. Theresa Tam said 1,800 cases were reported daily across the country in the past week, which is a good sign, and also informed that number of patients in hospital has also decreased by 55%. The death toll and the number of patients in the ICU have dropped by 40%. Dr. Theresa Tam said the Delta variant has also emerged in the community, requiring Canadians to use both doses to be completely safe.
Indicators of COVID-19 disease activity and severity continue to decline. This week, 7-day averages for case numbers have fallen below 1,800 cases reported daily for the first time since the fall of 2020. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has dropped more than 55% since the peak to under 2,000 daily. Of these, on average, less than 8,050 were being treated in intensive care units, which is 40% fewer than the peak number. And the average daily deaths are also down almost 40% to 32 deaths being reported daily. I know we are all eager to do more things we miss, and as provinces and territories accelerate second dose programs over the coming weeks, we are moving ever more quickly towards this. As always, things are not the same for everyone, everywhere. So deciding when and what layers of protection to peel back depends on several variables, such as our personal and family health and vaccination status, COVID-19 activity levels in your community, and what settings and activities we are engaging in. Though each of us have different health, work and family circumstances that affect our risk comfort level, expanding one-dose programs has provided many more people with priming immune protection to reduce the risk of serious harms from COVID-19 infection. But one dose of protection is not enough. Based on estimates before the Delta variant was circulating, an estimated 1/3 of people can still get infected after just the priming dose, and then an estimated 20% can develop serious illness. These estimates may be different with the Delta variant or other future variants. This is why public health measures and individual precautions continue to be important while COVID-19 is still circulating widely and second dose programs are ramping up. Getting fully vaccinated with a second immune boosting dose substantially lowers our personal risk of infection and serious harms, provides stronger protection against certain variants of concern, including the Delta variant, and may make immunity last longer. While we can all breathe a little easier knowing that most of us have received our first dose, with COVID-19 still circulating, we are all advised to continue following public health advice and keep up individual precautions until more of us are fully vaccinated and COVID-19 infection rates are low.
Brampton South MP Sonia Sidhu asked what steps the federal government is taking to mark the 100th anniversary of insulin. 6 people in Brampton and 11 million people in Canada have diabetes and pre-diabetes. Relying to this, the Prime Minister said that the government has set aside 35 million in the budget for the national framework. In addition, MP Maninder Sidhu thanked the healthcare heroes for vaccinating 1 million people in Peel.
Mr. Speaker, in my community, diabetes affect 1 in 6 Bramptonian, and across the country, there are 11 million Canadians living with diabetes or pre-diabetes. They are at risk of serious complications like heart and kidney disease, blindness, amputation, and many others. And they have been hit hard by this pandemic. As Canada recognized the 100th anniversary of the discovery of insulin, can the Prime Minister tell us what the government is doing to help people living with diabetes? Thank you, Mr. Speaker.
The Right Honourable Prime Minister.
Mr. Speaker, I want to thank the member for Brampton South for her question and for her unwavering advocacy on behalf of Canadians living with diabetes. We recognize the impact that diabetes has had on the health of Canadians and their families. That's why in Budget 2021, we're investing $35 million to develop a national framework for diabetes to help Canadians get access to prevention and care. This will build on the important legislation put forward by the member in Bill C-237. We will keep working to support diabetes prevention and care for all Canadians.
The Honourable Member for Brampton East.
Mr. Speaker, I am delighted to address the House today as we mark over 1 million doses being administered in the region of Peel. I'm incredibly proud of how far we have come, and this would not have been possible without so many on the front lines. I want to take a moment to appreciate the healthcare heroes who have cared for our loved ones in their most vulnerable moments. They courageously stepped up in our time of need and have sacrificed so much in order to care for our community. There are countless healthcare heroes who have contributed to Team Canada's pandemic efforts. Among them, Dr. Gurdwara, Dr. Anand, and the entire team who have been working nonstop with testing and vaccination at Embassy Grand in Brampton East. The courageous team at Brampton Civic Hospital. Some of the heroes among so many include Priya Hearn, Andrea and Alex Hall, Bindu Patel, Nicole Speed, Jennifer Shields, Mary Woodward, Candace Barone, Darth Tucker, and all the way from Newfoundland, Michelle Murphy. As we look to brighter days ahead, please continue reminding your family and friends to get vaccinated. Let's do our part to crush COVID-19.
Toronto Mayor John Tory briefed the City of Toronto on the COVID-19 vaccine rollout process. He also said the first phase of reopening is going to take place in Toronto, announcing that the vaccine rollout, he said, 2.44 million people in Toronto have been vaccinated. He also mentioned that the more than 70% of the citizens in the city have received the coronavirus vaccine.
Our progress getting people vaccinated and driving down our COVID-19 case count is continuing. Here in Toronto, more than 2.44 million COVID-19 vaccine doses have now been administered by Team Toronto. More than 70% of adults in our city have received their first dose of vaccine, and more than 10% have already received their second dose. And, as Dr. Davila will outline, our case count continues to fall. As we begin the province's safe and cautious reopening, we all have a role to play in making sure that it is successful. We need people to keep wearing their masks and following public health advice. City Council will vote later today on extending the mask bylaws because we don't want to lose the gains we have made in reducing the spread of this virus. I don't see a mask as a major inconvenience. I think most of us are accustomed to masks now and understand how they keep us healthy. They help protect the essential workers who've been working throughout the pandemic and many others who will be back to work starting Friday. And of course, they protect as well our co-workers, our family members, our friends, and others protect us from them and them from us to some extent. But as important as masks may be, most of all, we need people to get vaccinated. Please get vaccinated. Your first dose is important. Get your first dose and get your second dose, and make sure that your family and friends do it too. If you need more information, use our VaxTO COVID-19 text line by texting the word vaccine to 1-833-750-0888. I have a very serious matter that I want to share with you today, and it's an issue that was flagged for us from our supervisors in some of the immunization clinics. We are hearing about instances of the abuse of the staff in those clinics by the clients. This is going beyond aggressive behavior from people wanting an early second dose. That is unacceptable on its own.
Brampton Mayor Patrick Brown outlines plans for the upcoming reopening. The reopening is starting from June 11, in which indoor and outdoor gatherings can also be held on a limited basis. He also said that it would be necessary to have a distance of 2 meters for gathering during weddings, funerals and religious ceremonies.
First thing that I wanted to speak about today in regards to our COVID update is the upcoming reopening. On Friday, June 11th at 12:01 a.m., things are changing. There's some gradual reopenings. Outdoor limits for social gatherings and organized public events will be expanded to 10 people, including with members of different households. Outdoor religious services, including wedding services and funeral services, capped at a number of people that can maintain physical distance of 2 meters. Indoor religious ceremonies or ceremonies including wedding services and funeral services permitted at up to 15% capacity of the particular room. Non-essential retail is permitted at 15% capacity with no restrictions on goods that can be sold. And outdoor fitness classes, outdoor groups and personal training, and outdoor individual team sport training is permitted with up to 10 people. And so I want to thank the province for this gradual reopening, and we are certainly ready for it in Brampton. With the beautiful weather in the forecast, we have done our best to make sure our recreational amenities are ready for these pending changes. As a reminder to everyone, splash pads are now open citywide. The wading pool at Shinkuzi Park is scheduled to reopen for public on Friday as well. Also available for residents this summer are in-person summer camps. With the go-ahead from the province, we have our summer camps ready to start. You can select a City of Brampton summer camp by going to our city website. Registration is now open and summer camps start on July 5th. Residents can call 311 if they have any questions. I also invite you to enjoy new free open outdoor workouts returning 7 days a week in our parks this summer. Free outdoor fitness, a great way to stay active. The program has been expanded to offer residents more options to engage in safe.
Brampton Medical Officer Dr. Lawrence Law introduces COVID-19 outbreaks in the city. He said Brampton's positivity rate is 7% this week, adding that the positive cases reported this week, they are the lowest since 2020. He said patients are recovering in hospitals every day.
This week, Brampton's test positivity is at 7%, with a weekly incidence rate of 73 per 100,000. These are the lowest numbers that we have seen in our community since the fall of 2020. At our hospitals, patients are recovering and being discharged, and surgeries are looked to be starting up soon. And our vaccine coverage rates are increasingly impressive. The numbers speak for themselves. 1.2 million doses delivered, 74% first dose coverage of 18 plus in our community. 75% first dose coverage of 18 plus in our high priority hotspots as designated by the province. 81% first dose coverage in our 18 to 24 year olds. 78% first dose coverage of our 60 plus, including 44% second dose coverage, i.e. complete immunizations of our 80 and up population. These numbers mean that we are starting to see differences in our transmission patterns, and I want to thank Peel residents and businesses first for your sacrifices that have got us out of this third wave and made a difference, and secondly for your willingness to get vaccinated. That said, while these numbers give us all a cautious optimism, it's not time to fully start to celebrate. With step 1 reopening starting on Friday, we must remember that the science table has advised that the Delta variant is growing in Peel ahead of the rest of the province and will become the dominant strain in just a few weeks. And so today I want to talk a bit about patience. Like many of you, I love summer. Canadians wait all year for the magic of these long days and warm nights. And so I know that our residents have what it takes to be patient, to be able to hold on a little bit longer and put this firmly behind us.
British Columbia Premier John Horgan has announced that his government has approved the implementation of the Earl Growth Rate for the First Nation of Vancouver Island. He said that it was requested by the natives.
On the unceded territory of the Lekwungen-speaking people, Esquimalt and the Songhees First Nation. And I say that acknowledgement not just because it's appropriate to do so, but because from day one, my government has been focused on reconciliation, environmental protection, and building an economy that works for everyone. No sector is more important to the history and the future of British Columbia than our forest sector. I was here last week with Minister Conroy talking about our intentions paper for the broader forest industry, interior, coastal, old growth, second growth, how we build a value-based industry where we can create more jobs, keep more communities intact, and continue to have that success now and in the future. That does not change a past that has been focused on over many, many decades, decisions that have been made by successive governments on public lands to alienate those lands from the traditional title holders, Indigenous people, and also to not connect those trees, those forests, to the people that live in them. We're going to change that. We've made it abundantly clear since we were sworn in 2017, and the steps we've taken since September when we received the old growth report by Foresters Gourlay and Merkel, that we will implement all of the recommendations contained therein. But our forests are not just old growth, they're not just coastal, they're in every part of this great province. And managing those lands is the responsibility of government and title holders together. I was very proud to receive a declaration from the Huayet, the Dididat, and the Pachidat people earlier in the week, outlining their views and their vision for activity in their territories. Today, Cabinet has approved a request by the Pachidat to defer old growth forestry in Fairy Creek, as well as the Central Walbridge.
NDP leader Jagmeet Singh addresses press conference after meeting of his party. He discussed the attack on a Muslim family in London, Ontario. He also commented on the incident involving 215 Indigenous children. It's unfortunate that such incident happens in Canada.
For us in Canada, we are still reeling from the horrible discovery of 215 Indigenous children in unmarked graves in Kamloops, and the painful reality of genocide of Indigenous people in Canada and the ongoing trauma that Indigenous communities face. We also are reeling from the horrific killing of a Muslim family, leaving one small child struggling for his life. And that attack was motivated by hate against Muslims. It was an act of terror that was designed by its very nature to instill fear and terror into the hearts of the Muslim community. And coming out of these very painful moments, these very painful tragedies, Canadians are demanding action. Indigenous communities are demanding that the Liberal government take real steps. Instead of just words, they want real steps. So we're asking this Liberal government to stop fighting Indigenous kids in court. The court date is fast approaching. These are kids that have been found to be discriminated by Canada, both willfully and recklessly. And despite that Canadian Human Rights Tribunal decision, this Liberal government and Justin Trudeau are fighting these kids in court, appealing that decision. We're asking them to stop. To walk the path of reconciliation means not fighting these kids in court. And to the Muslim community that is reeling from this devastating terror attack, community wants to see real action to tackle the root causes of this hate. We know that in the Quebec massacre and in the killing of a Muslim man in Toronto, both attackers were motivated by hate, and they were radicalized by hate with online right-wing white supremacist messages that radicalize them to have so much hate to go out and kill Muslims. So we need to tackle online hate. And we need to see concrete actions. Donc, ce qu'on a vu dans les 2 semaines passées, c'était des événements horribles. La découverte de 215 enfants autochtones a bouleversé les gens à travers le pays. Et la communauté autochtone demande.
So that's all we have in this bulletin. Thanks for watching. Stay tuned for more updated news.